Hi, this is Jason Kilmer from the University of Washington, representing Washington's Young Adult Health Survey on a brief video about simultaneous use of cannabis and alcohol. I'm principal investigator of Washington's Young Adult Health Survey, and this is a survey funded by the Healthcare Authority's Division of Behavioral Health and Recovery that's taken place every year since 2014. In 2014, we collected data from 18 to 25-year-olds and got as much of it collected as we could before the first cannabis retail stores opened in 2014. So that it gave us kind of a pre-store opening data point so that we could look over time at the impacts of implementation of cannabis legalization. Every year since, we've collected data from a new group of 18 to 25-year-olds. We recruit our sample using a combination of an invitation with a direct mailing from a random sample from the Department of Licensing, as well as advertisements on social media platforms. It's a completely confidential survey that's been in place for 10 years. Now, one of the things we ask is if people have used cannabis in the past 30 days. When they say yes, they're asked, in the past 30 days, how many times have you used alcohol and cannabis at the same time so that the effects overlapped? Something that some people call cross-fading. From a science standpoint, it's a drug interaction. Among 18, 19, and 20-year-olds, you can see that on the one hand, 57.92% said, no, they don't do this. So balancing hope and concern, it's hopeful that most people aren't doing this. It's concerning, though, that 42.08% are reporting combining these substances at the same time. Now, among 21 to 25-year-olds, over half, 54.17%, said at least once in the past 30 days, if they've used cannabis, they've also used it at the same time, or vice versa, as they've used alcohol. Now, why does this matter so much? When people combine two substances that work in the same direction, it's a drug interaction called potentiation. Alcohol, as a central nervous system depressant, slows down central nervous system functions. Cannabis similarly slows the body down. Now, this is a mathematic formula where it's a case where 1 plus 1 is greater than 2. The challenge is we don't know how much greater than 2. It could be 1 plus 1 is equal to 2.5. It could be 1 plus 1 is equal to 3, 4, or more. So if someone crossfades, if someone combines substances, and they say, wow, I feel really, really tired, we don't know if they're really, really tired or if the body's shutting down. From a harm reduction standpoint, if someone says, I'm thinking of using alcohol, I'm thinking of using cannabis, if they're not combining those things, that's certainly associated with lower risk. One of the things available to 18 to 29-year-olds in Washington State is a program called Check In With Yourself that can be available, accessed and available at checkinwa.org. This is free, it's anonymous, and one more time, it's free. People fill out a short survey that includes information about their alcohol use or non-use, their cannabis use or non-use, other substance use, their mood, their coping, their connectedness, their loneliness, things like this, and then get personalized information about those domains. One of those domains includes videos explaining drug interactions in greater detail, both the potentiation one that I just described and antagonistic drug interactions, which occur when people use a stimulant and a depressant at the same time. If there's someone you're concerned about, if you yourself are watching this video and want to learn more about drug interactions, check in with yourself at checkinwa.org.